Lifestyle medicine. We would all like to live a long, healthy, active life and avoid any serious chronic diseases. So what is health? There may be no individual whose accomplishments were more symbolic of the integration of science and holism than the ultimate Renaissance man, Leonardo da Vinci. He realized holism needed reductionism to advance, and reductionism needed holism to remain relevant. He also realized that when you take something out of context to study it more closely or measure it exactly, you risk losing wisdom, more wisdom than you gain. Dr. T. Colin Campbell, PhD. So what is health? Is health what is left over after we remove all diseases? No. We all intuitively know that it is something more. Lord Horder many years ago said, "Perhaps we shouldn't have a Ministry of Health, but a Ministry of Happiness." Dr. Scott Williamson, a pathologist, and Dr. Innes Pierce asked this same question and spent the rest of their careers seeking the answers. They concluded it was based on family units supported by community in a stimulating and nurturing environment. It has taken over half a century for modern medicine to begin to learn these lessons. Connection towards a broader understanding of health in medicine today. The problem is that our modern medicine, reductionist medicine, has driven the best clinical and person-centered healthcare out of the normal application and provision of medical care. Great strides have been made in diagnosis, medical and surgical intervention, drug therapy, and sophisticated state-of-the-art diagnostic equipment. This is to be applauded as progress, but there has been an erosion of personal caring for the patient, who has become a condition, an impersonal name on a computer data bank. It was Lord Horder who foresaw this process beginning in the 1930s, and Dr. Peabody, a renowned physician of the same era, warned against the replacement of care of the patient with increasing technology and efficiency. Today we are discovering the amazing power of our minds in healing, and we are beginning to see holism slowly returning to our thinking and practice. This small book aims to stimulate more interest in the complex connections that relate to our state of health or sickness, from the food on our plates to global warming, environmental destruction, and the cosmos. Helping ourselves to better health. Our health is affected by many things, including our body mechanics, our diet, our breathing, our stress, our work, our family, our housing, our community, the environment, etc. But we have significant control only of three of these factors: our diet, our breathing, and our state of mind. Over the past 3 years, I have been researching the link between two of the major factors in our lives that have been proven to have a powerful influence on our health, namely our diet, what we choose to eat, and our breathing, how we normally breathe. I have discovered that these two seemingly separate activities are strongly correlated. How we eat affects how we breathe, and how we breathe affects what and how we eat. We now know that our diet can be responsible for the development of most chronic diseases, and that our poor breathing habits are also responsible for over 100 common health problems. So, if we could learn to improve both our diet and our breathing, not only would we reduce the risk of developing many illnesses, but also reverse pathologies in many cases, and we will be making a major contribution to laying the foundations for overall optimal health. Diet. About 90% of all major diseases are closely linked to our diet. We can reduce the risk of developing them or even reverse them. Heart disease, diabetes, strokes, Alzheimer's, IBS, most cancers, arthritis, MS, lung disease, hypertension. Our choice of diet can provide the nutritional supply to enhance and support optimal health. Breathing. Over 75% of us breathe badly. We suffer some degree of chronic hidden hyperventilation, and this is linked to over 100 health problems, including asthma, hypertension, anxiety, snoring, panic attacks, orthodontic problems, angina, ME, heart problems, sinusitis, arrhythmias, hay fever, sleep apnea, and eczema, to count but a few. Normal breathing. Normal breathing reduces the impact of stress in our lives, and that it is generally recognized that stress is a major factor impairing our health. Learning to breathe normally is essential for optimal health. Breathing is the first and last activity in our lives, and all mammals, I have discovered, and that includes you and me, have a given number of breaths in a lifetime, about 500,000,000,000. So perhaps how we breathe is more important than we thought for our health and longevity. Food, air and water. Like a fire, food is our fuel. Oxygen burns it and water controls it. We need food, air and water to live. We can live without food for 3 weeks or longer. We can live without water for 3 days. We can live without air for 3 minutes. Most of us in the West suffer from overeating, often the wrong foods, and overbreathing, usually stress-induced or just a bad habit. And most of us don't drink enough water. Remember, we are 50% water, and our nerves are not copper wires, but are water-based, so dehydration has a profound effect on all our nervous system as well as the functioning of all our cells. A real health assessment. Your diet. This assessment and training is based on the whole plant nutrition diet. Your breathing. This assessment and full training is with the internationally acclaimed Buteyko method. Hydration. Assessment and advice based on Dr. Batman Jeldi's work on dehydration. Your structure. Assessment if a one-to-one training in Hawkhurst of body alignment and function. Your stress. Assessment using the Lucia color test. Your exercise and body use. Overview of any exercise, sport, physical stresses at work, etc. Your medication. An overview of all medications and advice on how lifestyle changes may require your doctor to review them. Your medical history, a rapid review of relevant medical history that may relate to current health problems. The lifestyle course addresses all the above factors and provides training to help you help yourself. The online lifestyle course. 6 sessions of half an hour of online training over about 6 weeks. You will learn how to improve your diet. You will learn how to improve your breathing. Advice on other lifestyle factors will be covered. By making significant improvements in diet and breathing, you will reduce the risk of chronic diseases and improve your general health. Lifestyle medicine is now recognized as vital for our own health, the health of society, and the planet. For more details, contact Michael Lingard. Email lingard@totalhealthmatters.co.uk or telephone 01580 752 852.